Hi guys, my name is Julian Zangrilli. I'm one of the orthopedic surgeons at Seaview Orthopedics, and today we're going to be discussing some of the answers to the most frequently asked questions about hip replacement surgery to help you feel prepared and informed going into that procedure. The recovery after a hip replacement starts with working with the physical therapy team in the hospital. Whether you go home the same day or the day after surgery, our goal is to get you up and moving with physical therapy the same day of your surgery with the use of a rolling walker. After leaving the hospital, I encourage patients to continue the exercises they learn from the therapist in the hospital at home on a daily basis, along with walking around their house. You can start to shower with the surgical bandage on 3 days after surgery. Gently pat the dressing dry after. And while showering is okay at that point, do not submerge the leg underwater. So this means no baths, no pools, no hot tubs until you're cleared to do so. At about 2 weeks after surgery, I see patients in the office for the first time for their follow-up visit. We check the wound, and this is the point in which we start outpatient physical therapy, which is approximately 2 to 3 times per week. Physical therapy is a crucial part of the patient's recovery process. They will start with gentle range of motion and strengthening exercises, steadily increase your range of motion, and help normalize how well you're walking with your new hip. On average, 2 weeks is the point in time where patients may be switching to using a cane instead of a walker to help them walk on a daily basis. Also, at around 2 to 3 weeks after surgery, depending on their progress, patients can choose to start driving as long as they're off their narcotic pain medication and feel comfortable doing so. The course of physical therapy continues steadily week after week, and once you hit 6 weeks after surgery, I see my patients in the office for a second follow-up appointment. Usually, when I see them in the office at 6 weeks, they're no longer using an assistive device to ambulate, and 6 weeks is usually a safe point to start increasing low-impact activity, for example, increasing walking distances and activities throughout your day. Every patient is different as far as the activities or hobbies they like to engage in, so at 6 weeks, we discuss what activities are recommended based off of their lifestyle. The next time I see patients is at the 12-week mark. At this point, I expect patients to be approximately 90 to 95% recovered. You will continue to get stronger and progress steadily over the first year after your surgery. Please keep in mind that the timeline for recovery are averages. Some patients are slightly ahead of schedule and some are slightly behind, but the main point is to give yourself credit for slow and steady gains, that you stay positive, and remember that every hip replacement surgery and every recovery is a unique process for each patient. Pain control after surgery is targeted in several different ways. First is ice and elevation. Swelling is absolutely expected after surgery, not only around the hip, but throughout your entire leg. Icing your hip 20 minutes on and off throughout the day and elevation above the level of your heart for 20 to 30 minutes at a time are both key. Along with icing and elevating, I remind patients to try to be mindful of gradually increasing activity levels. We live in a time where most patients are equipped with cell phones or other devices that can monitor step counts throughout the day. So throughout the recovery process, we outline step count goals to not only keep patients active and motivated, but also to help guide them in gradually increasing activity. Aside from monitoring activity levels, ice, and elevation, there are different medications that we use to control pain after surgery. Both non-narcotic and narcotic meds are used. Some of these medications are scheduled, and some of them are used on an as-needed basis, depending on your pain levels and your medical history. I usually expect patients to be able to slowly wean off and ultimately stop using narcotic pain medicine between weeks 4 and 6 after their surgery, sooner if able, depending on their pain. Anytime a patient has a hip replacement surgery, there's a risk of developing a blood clot in your leg. Because of that, patients are started on a type of blood thinner after surgery for a period of about 5 weeks. The specific type of blood thinner that's used is dependent on the patient's medical history. The combination of using a blood thinner, compressive stockings that you'll receive on the day of surgery, and getting up and moving throughout your day help collectively lower the risk that you develop a blood clot. Please keep in mind that the pain, bruising, swelling, redness are all expected to some extent after your surgery, and more often than not, this is a part of the normal healing process. Even after your pain is minimal to non-existent weeks after your surgery, it's still possible that you will experience some level of swelling in the months following. This swelling that you may or may not experience should respond positively to a period of rest, ice, and elevation of the leg. If at any point in time you start to have wound healing issues or draining from the surgical incision, please contact your surgeon as soon as possible. Overall, we understand that surgery can be a very stressful process, not only for patients, but for also their families, and it comes with a lot of unknowns. So I just want my patients to know that myself and my care team are here for you every step of the way, and we're happy to take care of you through this process.